So, well, friends, welcome to today's webinar on artificial intelligence in non-radiology images. And you heard Dr. Professor Arun Jamkar last week, and he's continuing with the same sessions. And all of us know him all over India. I mean, he's the former Vice Chancellor of Maharashtra University of Health Sciences and also a distinguished professor at Symbiosis International Medical University. And also currently a consultant healthcare and life sciences at Persistent Systems Limited at Pune. And also he has worked in USA on Index Technology, Cupertino, USA. And he is also a thought leader at Inpods.com and founder chairman of Association of Health Professional Universities of India. He has got a lot of activities under medical education, which I had spoken last week, and I mean, the list is huge. So currently he's speaking on artificial intelligence in his new innings, and I'm sure he will be creating newer paths in this direction. So with this, I hand over to sir. Yes, sir. I can see your screen.
Thank you, Sanjay, for inviting me to give this extended talk on non-radiology medical imaging. Last time, while I talk about what are the success stories of AI, I gave, say, a bird's eye view of other non-radiology, rather radiology images. And then there are some mentions about non-radiology. Then Dr. Bedi thought I should expand it a little more. And keeping his request and my affection for artificial intelligence, I thought I should create this extended lecture which pertains to non-radiology. And those of you who are attending this first time, I might just scan those slides to just have some introduction. But at the end, whatever we talked of last lecture will be omitting, and everything would be new. And as usual, say, Martin Luther King has said that inequality and injustice in healthcare is most shocking. And everybody tries to give technology for better healthcare so that this inequality can go away. Now, henceforth, I think most pertinent point before society and public is healthcare. And believe me, now the next elections would be fought on how better you give healthcare. And at the same time, it has to be affordable, it has to be available, and it has to be, say, 24/7 available, and it has to be low cost. And for all these, technology is important. And here, I suppose we can use AI. And when AI, we mean simulation of human intelligence in machines that can perform the task. John McCarthy in 1955 used this term first as a machine with an intelligent behavior such as perception, reasoning, learning, and communication, and the ability to perform human tasks. If you see AI, the maximum utilization of AI has been in images. And for imaging, you require what is called as a GPU. And my son works in a company called NVIDIA, which manufactures the GPU. And the growth of GPU, what is called as Moore's law, is faster than CPU. That is, and I think now recently you can see how the growth is going ahead and ahead. And NVIDIA unveiled a monstrous A100 AI chip with 54 billion transistors. And this was the biggest thing to happen. While I was preparing, so last week, CDAC of India has launched the AI's first AI supercomputer called Airavat. And I hope you all know that Dr. Bhatkar, who's supposed to be father of supercomputers in India, has retired, but might be his company called CDAC is now coming into manufacture of this Airavat. Now, this is supposed to be 75th fastest computer in world, and it has a 500 global list. Its manufacturer is NetWeb Technologies, and the operating system is Ubuntu 20.04.2. I had a pleasant memory of working with CDAC as well as Dr. Bhatkar long time back in maybe 1995, when I was trying to introduce digital X-rays, where we were all still, say, exposing X-rays and all that films. And if you see any film meets human eye in its life for maximum 5 minutes. And that's why digital X-ray were not there. And we were collaborating with CDAC, as I was in BJ Medical College, a professor of surgery, and our professor of radiology. We worked together. And then we were there to modify a first time a radiology imaging handling model, which can be perfect, because there are not many factors in image handling which we do not know. And at the same time, if a computer guy puts those, then it will be superfluous. So we were there to identify and make it radiology friendly. AI in healthcare, and this I talked last time, and I think we know about medical imaging, predictive analysis, then personalized medicine, EHR, virtual assistant. So these are all examples of AI. And then I got this poem from ChatGPT, which says about how AI is working. And then in telemedicine and AI, I bridge the divide, connecting the patients and doctors worldwide. With chatbots and virtual assistant, it communicates, providing guidance, easing worries, and answering threats. But amidst this progress, we must not forget the essence of care and the human touch we beset. For AI is a tool, companion to embrace, but empathy, compassion, and no machine can replace. I think this is the one which we need to understand, that the human touch is important. And that's why we are trying to do something far more, what is called as an artificial wisdom. So this we discuss, I'm just flashing slide, AI, ML, DL, and how they are related, and how the big data is being used, and how big data can only be used for human, say, for use of medicine. And this thing only can do with an artificial intelligence, because it is tremendous, because we diagnose disease based on our personal histories, biomarkers, simple scores, physical examination, and details. where AI can diagnose the disease based on complex algorithms using hundreds of biomarkers, imaging results from millions of patients. I think that's why AI can be used for better diagnosis. And in addition, the AI can tell you something that where is the knowledge available. And I think Chat GPT or even Google GPT, and now I think even Binge has come with something like Chat GPT, because the knowledge, the definition is changing. The half of the knowledge is to know where it finds knowledge, and because there's so much of explosion that has to be taken care. So pertaining to the last two stanzas of that poem, we are now concerned about machine-like human qualities such as empathy and compassion to be added, and then we call this as artificial wisdom, where the top-level decision-making which gives a complex, challenging situation, because we have data, information, knowledge, and wisdom. But then up to knowledge, AI can do. But for wisdom, you require something more. And artificial wisdom involves developing AI systems that can comprehend complex situations. I'm audible?
Yes, sir.
Because he suddenly said you are signed out. So the goal of artificial wisdom is to bridge the gap between the capabilities of AI and human wisdom, enabling machine to assist humans in making more informed and wise decisions. That is more important. The decisions are wise. At the same time, it has to be humanly. So it involves leveraging advanced AI techniques such as machine learning, NLP, knowledge representation. At the same time, vast amounts of data and apply to the knowledge in wise manner. And that's how it's called as artificial wisdom. So artificial wisdom has broad application in healthcare, finance, education, and we can potentially enhance the decision-making process. When I thought, what are the research papers in this area, there are several research papers available. I think it's a developing field. But then for healthcare use, we need to understand that we have to find out how can you have artificial wisdom for healthcare. And the other areas of artificial wisdom is ethics. So where whatever we do is ethical. And therefore, we need to have a change from ethics of AI to ethical AI. And then what are the components which concern is the transparency, data security, autonomy, responsibility, human bias, and accountability. These are all components of concern of human as regards ethics is concerned. Therefore, we need to understand that all these AI systems, they led and say ethical standards, they have automation and job replacement, because we need to honor the jobs are not replaced, accessibility, civil rights, democracy. So once you add all of them together, then an ethics of AI, we need to create what is called as an ethical AI. So I think this with the background, we need to go back and say that we want to have a artificial wisdom, and that can have more quality of being wise. Now, AI and ML, these are the decision making and the medical imaging, and same process is for non-radiology, because the biomedical X-rays are come under radiology, whereas CT scan, ultrasound, and MRI, although it is done by radiology, we can count as a non-radiology. Then we have pathology, endoscopy, dermatology, cardiology, nuclear medicine, and the list is long. So, but the process is same, that we have a data preparation, and then it on non-medical image, non-radiology images also go into image cycle, where you have labeled data, and then you have to find out, and then all that ML, supervised learning, unsupervised learning, all those K-mean clustering, and everything that we talk about in radiology imaging continues in non-radiology imaging. And this was covered last time, that's why I will skip, and then we go directly, because you understand what is DL and what is deep learning, the statistical learning, machine learning, and how they are correlated, and how the DL is with computerized hidden layers, and then it forms like a network, and then these are all development taking place, and then extendable AI. So these, I think, I just want to flash because the recording will be available so that those who want to study, they can go back and study this. So with this background, we go
about this.
now to artificial intelligence in non-radiology. So, so what are them? Pathology, obviously, digital pathology, oncopathology, and routine pathology. And pathology per se would be a separate topic. I'll just give some brief mention. Dermatology is something where tremendous development has taken place. Ophthalmology is another area where the retinal images, OCT, everything has been done. And then endoscopy, I discussed last time. So maybe we can skip. Cardiology will have a little more expansion, and neurology also we talked last time. So the medical imaging workflow is same, planning, scanning, and then reading and reporting. So this same image featuring cycle is there. So let us go back and find out what are the things we are doing in skin, that what is called as dermatology. Now, dermatology being that whole thing which depends entirely on human eye, and determination of the diagnosis depends upon how nicely and how precisely you look at the skin disease. And then we have, if you see the development in 1998, there was called mole analyzer, I think, which was a sort of a camera. Then from 2006, they're applying AI. And then we have now 2017, we have Mole Analyzer Pro, and then all these developments are taking place. And when there are more and more artificial intelligence, that ML systems are being added. And then this is available as a photo finder, where all these images are available in that format, and it helps you to develop AI system for skin diseases. So there are several papers available, and then this I showed last time, where a convoluted network showing highly variable, and then the classification of skin disease where, with a single CNN, and then image directly using pixels can be used as input. And then the author tested 21 board-certified dermatologists on biopsy-proven clinical images with 2 critical binary classification. And I think they were better than dermatologists. And other thing which where the Western society is concerned is about melanoma, because melanoma is something which is not common with us, but then it's very common in Western societies. And then look through what is called as a dermatoscope. So a dermatoscope is a technique that involves examining skin lesions, which provides a magnified view, and then we can record and those images and apply AI algorithms. And then once you do that, you can apply ML systems to have a computer diagnosis, and then obviously it can give the risk assessment, then treatment optimization, and then it can be remotely sent, the telemedicine model, and the remote monitoring and the research and everything can be done. So this is a dermatoscope where you have to apply an ultrasound jelly and then put it and then look into it. And then you can have attached camera and it can record. And then what happens is all that image is augmented, then it goes into training in the same model like radiology. And these are the various papers available on use of ML AI in dermatology. And I think those who want to go further can study them. And then one of the things I thought I should go, and this is the one where the 100 cases of pigmented skin cancer were done with the 2 level readers in 1906 dermatologists, level 1 dermatoscopy, level 2 clinical close-up. And this is the one where if you read and find out carefully, the radiologist and radiologist and AI system were going hand in hand. And then the decision was under less artificial conditions and broader spectrum diagnosis, CNN and most dermatologists perform the same level. So we did not just overemphasize that ML and AI will always be better. We already have an app called First Derm, which is available, where you have to submit 2 images, and then it gives diagnosis through AI. And I think I would request a dermatologist friend to develop such type of apps, and I think it would be far more easy and far more cheaper. And India being, say, our population being our strength, we can have all these images, and then we can just copy First Derm like thing. Then we go to, say, ophthalmology, diabetic retinopathy and other diseases. We talked this last time because in retinopathy, say, fundoscopy cameras are coming with, say, ML-based technologies. And then here, because the variations in the images are not much, the competence of AI system is getting better. Now you can see the, say, 95.8%, and I think IART, automated screening software, is showing you far better results. Then AI can give you for, say, detection of optic disc abnormalities, like with the papilledema or other things, and this obviously this gives you far better results. And then detection of glaucoma and what is happening because the pressure changes could be done with putting a sensor inside that system. And I think this is an additional advantage that in addition to image handling, you could have some sensors to find out the pressure, and correlation of sensors with the pressure can be done. Other thing is OCT, and this is an OCT image. And then if you can see OCT, this is an machine where we have OCT, and then OCT images. Actually, they are the first 3-4 things are common for all, because there is image analysis and segmentation. So AI algorithm can analyze OCT image accurately and segment them in different types of it. Then disease diagnosis, like an OCT images can give you, say, training of data set and OCT scans. Then disease progression can be done, so that suppose you have done OCT continuously, the parallelly, then you can, the system can look at the OCT earlier and find out what is the progression. And therefore you can do a treatment planning. And image enhancement. Now this is the other basic advantage of ML systems is the image enhancement. Because sometimes there are some images which you can't see better, and there might be some areas where you could be confusing. But then image enhancement and artifact removal can reduce artifact, noise, imperfections, and it can enhance the quality of OCT image, and it gives you a real-time assistance. I think this is something which is far better. And it is important to note that AI is promising, but ophthalmologists and other healthcare providers remain essential for interpretation. Therefore, ML and AI will not replace doctors. Now, this is a small video of showing you.
Thank you, Dr. Anand. To be like 0.7 yet. And most of the report achieved quite AMD or detecting light. In terms of color fundus photo, the most common objective for using AI for analyzing all the color fundus photo, maybe using it as the screening or detection tool for referable AMD or detecting light AMD. Most of the studies so far use data sets from the ARES study, which is a last study, but most of the study contain validation within the data sets from ARES. There's no validation in new data sets yet. And most of the report achieved quite a good results. The area under the IOC curve was around 90% for detection and around 70% for prediction. I'm going to show you later. This is an example of a study that used AI for analysis on color fundus photo of AMD and classify AMD into like 4-step scale and 9-step scale. In terms of 4-step scale, the kappa score was found to be like 0.77. For 9-step scale, the kappa is about 0.74. In terms of prediction of the 5-year risk of AMD, the mean estimation error found in this study ranged from 3.5% to 5.3%. Here, if you have a look at the accuracy of the human grader over here for the 4-step scale is 73.8%, but for AI is 75.7%. But if you use AI for making classification on 9-step scale, the accuracy comes down to be only like 60%. This is another study using AI for automated detection of GA from color fundus photo. This is for detection of GA as a whole. The AUC is around 0.9, and this picture, this is for detecting central GA. The AUC is also 0.9, but in terms of detection centrality of the lesions, the AUCs come down a little bit to be around 0.8. This is another interesting paper. They try to use AI for detecting reticular pseudodrusen from fundus autofluorescent images and color fundus images as well. Well, in terms of reticular pseudodrusen, it may be better detect using FAF, right, instead of color fundus photo. But we try to use color fundus photo to detect. Anyway, if you have reticular pseudodrusen at baseline, you're gonna have the late AMD faster than if you didn't have the drusen at baseline. For this study, the AI was developed by having data from the FAF, and they transfer the data into the color fundus photo. And then at the end, they developed 2 models. The first model is doing detection on analysis on FAF, and another model is performing analysis on the color fundus photo, which have data transfer from FAF into the color fundus photo. Well, for the validation data set, well, they try to find the best model, and they find that, well, if they use the model to analysis on the FAF, the AUC is 0.94, but for the color fundus photo, the AUC is 0.83, slightly lower. Well, for the testing data set, when they compare to human experts, for the model that make analysis on the color fundus photo, well, you can see the AUC is slightly lower than the FAF model, but it's still better than the human experts over here. In terms of
this is a video which I downloaded from YouTube. I'll give the link. I think it's another 10 minutes. So, but then I think it would be very useful. Then whether we can use AI for mammography and the forensic sciences. Last time, some professor of forensic medicine was talking about this. And then it has not been used, but then autopsy analysis, AI algorithm can assist in the analysis of autopsy data, X-ray, chest, and all the radiology images. It can help in forensic pathology, forensic imaging. AI can enhance analysis of image taken at the crime and seen during autopsies, and facial recognition, data analysis. And then one of the things where AI model can be trained to find out time of death estimation, depending on the body temperature, lividity, and rigor mortis. So this, I think, one area which AI can help. And then, because while we are trying to find out how ML is say helping, there are 2 things which are happening. One is what is called as segmentation, and second is called annotation. Now, image segmentation is more important because these techniques enable the extraction of meaningful information from medical images, aiding in diagnosis, treatment planning, and medical research. So that segmentation is something which helps you to find out what is happening. So we can either do by the traditional machine learning or CNN, and these models have what is called label data. And last time I showed about how segmentation is helping to find out an image classification coming into class, the segmentation, and have a better image. And then other thing is called annotation. I mean, annotation involves labeling of a marking of specific region or structures with an image. So either you can do say manual annotation. Let us say on left side the liver is annotated. So this is helpful. Or whether you can have semi-automated annotation. This approach combines the expertise of medical profession with automated tools, and we can have what's called weakly supervised learning. So these are the two things which are coming in everywhere. And I think annotation, image segmentation is helping ML for all those non-radiology or maybe radiology images. Then last time I talked about mammography, how this is helping you. And then I'm just going to flash because this is one of the area of a low-hanging fruit where ML and DL are showing better than, say, a panel of, say, 10 radiologists. And these are the various papers available to find out how AI in breast imaging is helping. And I think this I talked last time, therefore we just scan these slides. Then we come to AI in digital pathology, where I think first time you can find out in the digital pathology images, or then the segmentation is more important because we need to identify nuclear segmentation, epithelial segmentation, carcinoma localization, and then this helps you because at the end afterwards you are able to detect lymphocytes, mitosis, classification, and therefore this helps you to identify. And last time I told you that FDA had approved ML in histopathology before retinoscopy, but I think the growth has not been very nice. And this is about 3D images. And now instead of any image, say slide, you can have a whole block of liquid, say tumor to identify. And then we have what's called the handcrafted approach. This I talked last time. And I think the AI approaches have been developed using 2D stent slides, but now we can have 3D images of entire tissue. And I think that would be far better. And this we talked that how we are using it in neurology. And then
I think that's an artifact of a training center.
so I think this is very excellent presentation. How now this is from University of Michigan, where a neurosurgeon sitting in operation theater can send the samples online on the cloud, and then he get diagnosis. I think the whole need of fast diagnosis and fast biopsy is obviated. And then there are papers available of how they are being used. And then oncopathology, there are the various papers. And I'm not going to talk more because I think Dr. Bedi said there will be a separate section on oncopathology. And these are the various papers of deep learning and how it happens. I can share them with you. So as regards AI and machine learning in radiology or non-radiology, the word forward is what's called as a collaborative intelligence. And we need to understand the limitations. At the same time, we need to understand what are the advantages of ML and how it can use it better. Then I talked the last time about radiomics. So radiomics is a field of medical research and image analysis that focuses extracting quantitative features from the medical images, which could be used for non-radiology images of CT, MRI, PET, and then we extract, and then we try to follow, and then we try to match with the images that we have, and then radiomics has the potential to transfer medical imaging by enabling more personalized and precise diagnosis, and therefore it can give you better output, and we can give you prediction. So we have reprocessing, we have histogram, geometry, texture, and then we have model building, and then we have model assessment, and then at this juncture, we can have all say past patients same data, and then we are able to identify. So say there are similar 5 patients before, and what happened to them, and then we are able to predict what is exactly happening. So now we are trying to use radiomic biomarkers for immunotherapy, where same thing can be done. Lesion imaging, pre-processing, filtering, and extraction, and these are all the radiomics picture. And then this gives you the similar patients identification in past, and we know what is happening to them. We know what is the outcome. We know what are the treatment protocol followed, and then we can match with the machine learning technique to the present patient. And I think this is how that whole thing can happen. Now, Duke's University, long time back, they were working on a similar project. Suppose they just had patients of myocardial ischemia. So, and then they were exposed to all battery of tests. And then suppose we have 5,000 patients of myocardial ischemia to myocardial infarct. The Duke University experts found out that instead of having 4 or 5 types of clinical staging, they were able to have more than 50 clusters. Those were depend upon all clinical features, radiology, and laboratory. And then when a new patient comes, now all these patients were followed. And then when a new patient comes, and then same investigations were done, they were able to identify which cluster the new patient belongs. And then they were able to perfectly predict the outcome, and they would change the protocol. So I think this was something which was done, say, 10, 15 years before. Then the word radiomics was not there, but I think same thing is happening here. And then this analysis of oncology showing you all these patients happening, where the patients, earlier patients in, say, behind, and then you are able to do what is called as a carcinoma immunotherapy, especially in the monoclonal antibodies prediction, and give a treatment protocol. Then can you have AI in cardiology? So cardiology, the AI is in forefront. It allows accurate prediction of cardiovascular outcomes, non-invasive diagnosis of coronary artery disease, detection of malignant arrhythmias, diagnosis, treatment, and prediction. I think this is something which is far better, where AI can have those CNNs and automatic detection and find out the difference between the plaque and the narrowing and the stenosis. And then now this is one of the CNN of automatic detection and classification in coronary CT angiography, where they're able to identify whether it is segment level stenosis or not stenosis, far better. These are one of the nice paper which says that you can predict. And then because this becomes a very complicated matter, so the hidden layers are more. In machine learning or supervised machine learning, say, or the deep learning, the hidden layers play a role. So in a deep learning, the hidden layers depend upon the complexity. And suppose we have 50 hidden layers, that means the complex medical condition has been addressed. And this is the deep learning analysis of left vertical myocardial in CT angiography. And you can find out the sensitivity get almost becoming 100%. And it is getting you more accurate. And I think we'll have better and better systems to identify cardiac disorders. Nuclear medicine is something which I wanted, because last time I just give you one view, but then I just went into more details, because we have various radiopharmaceutical availables. We have technetium-99, iodine-131, gallium, indium, and then iodine is used for maybe PET. Technetium is used for magnesium for the bone scans. And then we have various nuclear medical scan. Bone scan is done with technetium-99. Gallium scan is used for inflammation, infection, and certain types of cancer. Then we have hepatobiliary scan, then liver scan, spleen scan, Meckel scan, then we have thallium scan, and a renal scan. And renal scan also we have what's called a DMSO scan, DTPA scan. So these are all scans. And then for the SPECT, what is called as positron electric CT scan, and then the thyroid scan and radionuclide. So the SPECT has been used. Now this is a machine of SPECT, and then what's called a single photon emission computed tomography, where the first thing that happens in all these scans is improving the quality of image, because the images are not very, very accurate or precise, and therefore the image reconstruction, they can improve the quality of SPECT scan by making it clear, getting accurate data, and then these algorithms enhance resolution, reduce noise, and compensate on potential artifacts. Then, and as usual, all ML is using for the segmentation. So automated segmentation, and then SPECT scan, the automated segmentation works better. Obviously, it can give you diagnostic support and then treatment planning. Now, Canon is working big in this area.
Canon Medical are proud to introduce the brand new Cartesian Prime, a new path to digital PET-CT. The most compact digital PET-CT solution and the only completely air-cooled digital detector, the Cartesian Prime leverages the potential of SIPM photosensors to create a balanced detector design. A design that allows for the availability of deep learning PET image reconstruction and that gives you superior performance. Including 263 picosecond time of flight resolution, achieved by utilizing 100% coverage of the SIPM and our unique one-to-one coupling in our detector design, and by providing a large 27 centimeter field of view to improve productivity and reduce scan times. The Cartesian Prime was designed to empower you to chart the right clinical course for your patients, keep patient and operator care on track, and help guide your business with confidence. Today, I'd like to explore clinical confidence in PET-CT, driven by artificial intelligence, by introducing the concept of deep learning image reconstruction and discussing the impact that this innovative technology can have on CT and PET image quality and dose. Artificial intelligence certainly has been the buzzword in medical imaging for many years. And now there are a multitude of AI products and software being developed and starting to become available, with many of these being focused around computer-assisted detection and reporting. However, at Canon, the first priority in our artificial intelligence roadmap has been to develop and utilize AI technologies to maximize image quality. Because if we can achieve the best possible image quality, then it makes the development of all downstream AI technologies easier and more accurate. And achieve this we did with the launch of our Advanced Intelligent Clear IQ Engine, ACE. ACE is the world's first deep learning reconstruction technology and uses a new and more effective approach to image reconstruction in modalities like CT, MRI, and PET to deliver superior image quality. Deep learning is a subfield of machine learning and utilizes the power of deep convolutional neural networks to train an algorithm to perform a specific task, outperforming even humans at tasks such as object recognition. Unlike conventional algorithms that are constrained by pre-programmed rules for performing a complex task, deep learning occurs when a neural network learns from its own intensive training process and develops its own logical structure. ACE features a neural network that has been trained to differentiate true signal from image noise. This training process occurs in our factory, where the algorithm is trained using large quantities of high SNR and high resolution input data. The goal of image reconstruction in medical imaging is to facilitate diagnosis of patients by converting the raw projection data into an image of the highest possible quality. Because ACE is trained with the highest quality input data, it enhances signal while suppressing image noise to create high-quality images at reconstruction speeds fast enough to keep pace in a busy clinical setting. Now, it's usually at this point in a presentation that questions arise around how we can trust deep learning. If the technology is trained using clinical data, what happens when something appears in the image that the algorithm has not seen before, like pathology or an anatomical variant? Well, this video is a great way to answer these questions. Both the images on the screen are CT datasets, where something unusual has been inserted into the data. The image on the left has been reconstructed using a conventional algorithm, while ACE has been used on the right. As you can see, both reconstruction methods detect and preserve the integrity of the gorilla head. Now, this is because ACE is not trained to produce the perfect image or take image data and make it look a certain way. ACE is trained with the specific task of differentiating what in our image data is signal and what is noise, so that when applied as an image reconstruction algorithm, all its job is to suppress noise and enhance signal, maintaining the integrity of image data and, in fact, producing images of high resolution that enhance the clinician's ability to detect subtle abnormalities and resolve fine details. ACE really is the next generation in image reconstruction and is an AI technology that can offer tangible clinical value to our customers and their patients. The Cartesian Prime features ACE deep learning for reconstruction of CT images and will soon include this innovative technology for reconstruction of PET data. This provides our customers with the ability to leverage the Aquilion Prime SP to perform ultra-low dose CT scans without compromising on image quality, but also the ability to reduce the cumulative radiation dose to patients for PET-CT examinations, while significantly improving diagnostic confidence and the ability to delineate subtle abnormalities on both CT and PET images. The benefits of ACE for PET may also be leveraged for improving throughput and reducing bed times.
I think this was one of the beautiful video which concludes whatever I talk in my whole session and how to identify how the whole thing is doing in these areas. So the class, I thought I should have some more thing about thyroid scan, where AI systems and ML, DL are used. And I think same thing, image segmentation, lesion detection, quantitative analysis, and decision support system. So it is the same thing is available. And then this was one of the nice paper available where deep learning enabled automatic localization of metastatic lymph nodes of thyroid cancer. And I think here, it was better than clinician, and it was using computative segmentation network, and it's one of the success of using DL systems in IO131 scan, and these are the same pathway, input data architecture, and then going into DL, and then going down. And this was another area where, say, AL is being used in Parkinson's disease with a single photon emission photography. Now, AI in ultrasound would be a separate topic. I just had one paper of deep learning algorithms to assist a thyroid nodule diagnosis in management, and it was a multicentric study where ultrasound was being used, and then training sets is called ThaiNet, and then it was finding out that the ThaiNet was far better in identifying. It's an ultrasound thing, because I didn't want to go into detail, because that might be another topic by itself. But then this was one of the very good paper to identify DL systems being used in say, thyroid ultrasound. We need to understand that although we talk big about AI systems and DL in medical and non-medical, we need to understand what are the limitations and failures. What are the limitations? One, it could be misinterpretation of image. AI systems rely on data they are trained on. So suppose it is a giga, garbage in, garbage out. If the training data is flawed and biased, AI may make incorrect interpretation of medical images. So I think this is first. Then lack of generalization. AI algorithms may perform well on specific data set. They were trained, but the struggle to generalize to new and diverse cases. These limitations can result into misdiagnosis and incorrect assessment. Or reliance on AI. Some cases, medical professionals may place too much trust in AI and their recommendation without critically reviewing and verifying results. This over-reliance can lead to errors and incorrect diagnosis. And limited transparency and interpretability. Many AI algorithms, particularly deep learning models, can be complex and difficult to interpret. And so spontaneously, there could be lack of transparency, which hinders understanding. Then adversarial attack. AI system can be vulnerable to adversarial attacks, where malicious actors intentionally manipulate the image to deceive the AI algorithm. And by introducing subtle perturbations and alternation image, attackers can cause misclassification. Obviously, ethics, and therefore, these are the, it is crucial to acknowledge these failures and limitations of AI system in medical imaging. So these are the software programs available. And so in conclusion, like last time, AI algorithms can analyze a medical or non-medical image, and image segmentation annotations are more important. It can give a computer diagnosis, then image reconstruction enhancement can be done, and we can have workflow, say, automation, and the research and training, radiomics and predictive modeling can be done. And I think we need to understand an ethical component, and then how it can be made to see that we have a artificial wisdom working in these areas. Thank you.
So thank you, sir, for this excellent talk. So basically what I understand, that wherever there are images and there is data associated with those images, and you combine those images with large number of images with large number of data, and we get artificial intelligence.
Yes. And that if you can see the last video I showed, it gives you exact detail because it is so nice. It encompassed everything in imaging.
Yes. And with the availability of digital images, this process is becoming easier and easier day by day. So the session is open to discussion, and you can unmute and ask sir some questions, some comments, or some thought processes. Government of India is, me and sir were discussing, Government of India is making some, the health records of 1.4 billion Indians available online. And I remember there is a company called Cessner, which takes the British Health Service, National Health Service patient records, and they have made that available for study free of cost, or there is some cost, but they are available to medical students for study. I mean, they have removed the patient's name and address, but the records are available. So in India also, which as time passes, more and more images will be available for Indian population. But now the real challenge is that these images need to be put into AI platforms, and the data linked to those images needs to be captured. So any question, anyone? There's a question by Dr. Rashmi Jaiswal. Is knee or hip replacement surgeries AI dependent?
Actually, it is not AI dependent, it is robotics. Where the creation of the prosthesis is AI dependent. So going into 3D models of CT scan or MRI, they create a whole image, and then nowadays they can create what is called as a 3D printing model. Once it is done, we identify what is the area of diseased, and then we can map that area with an robotic arm, and which is just a Bluetooth dependent technology where we map. So we should know where to go, and we identify the extremes. And here, whether when you are getting to the extremes, the AI could be used to go back and compare with the images available on the CT scan. And once we do that, the system trains, and then it doesn't let you go outside that area. As a net result, exact amount of bone which is diseased is removed, and exact amount of bone that is required to put that prosthesis is used. And therefore, there is a less morbidity, less, it becomes more accurate, and then patients are able to walk next day. And the time required is reduced by almost 30%, rather 60%. So one of my student who does, Dr. Narendra Vaidya, he does at least 7 to 8 TKR per day, and everybody walks next day. And because there's a minimum handling and there is no less trauma. So, but then obviously it is a robotics arm.
Yes, sir. Thank you. So, yes, in fact, some days back I went to my dentist and she created my tooth using this 3D printing.
Yeah.
And this 3D printing is coming
Big way.
with leaps and bounds.
Now here what happens, because I am consultant through Persistent to a company called a Monogram, where we are working on TKR, and those 3D printed say prosthesis, they are porous. And as a net result, after the prosthesis is put in the bone, the Haversian and Volkmann canal system grows inside, and the prosthesis becomes part of the bone. And what we do as an wearable, is we put some sensors in tibial plate. So subsequently, you are able to identify the movement of tibial plate, and then that could be one of the factor, and then reduce it so that we can train the people to have more exercises, and it can be personalized. So I think this is something
Okay,
which is coming in big way.
great. There's a question, can we have AI solutions developed using non-annotated digital images in pathology?
Actually, annotation helps you, but then I think this you can answer better, because I think the next session would be on digital pathology, which is taken by you.
Yes, I mean, there's another doctor who is more trained in that. She will be taking, and there's 2-3 sessions and more. So yes, non-annotated. I mean, basically the annotation, though it helps, but for diagnostic purposes, there are in pathology there are patterns, and AI has to pick up those patterns. Yes, non ultimately, once these patterns are of large number of images are correlated and linked with this data, I mean, they are going to become a boon. I mean, people say, will AI replace humans? No, it won't, but it will replace those humans who don't use AI. Dr. Navneet is asking AI in pharmacology.
There is a tremendous use of AI in pharmacology. I think last time I don't know whether I talk here, but during COVID times, AI helped to develop new drugs. So the first thing was what is called the repurposing of drug, where say thousands of molecules were available, and a company called Benevolent AI, they did and find out which one can be used without going to clinical trials in COVID. And that was a drug called Bacitinib, which was entirely a discovery of AI in development of drug. So drug development has become very fast, and there is a separate branch of medicine called in silico medicine, where you can have drug trials with limited patients, and then AI can help you to identify how we can have a smaller data. And I think it's a big area again, but then AI is say helping a lot to develop better drugs and faster drugs.
There is a question. In the chat, how do we ensure such wonderful solutions are actually used by end users at bedside? I can see a lot of talk in research papers, but hardly any change in the way of doing old things on the front lines. Where are the gaps and how to address those?
So if you look into my slide of limitations of AI, I discuss same thing. And in beginning itself, I cautioned about say getting in AI into ethics to ethical AI. And I think ethics and say bad manners and everything is a human tendency. So at the end, human values become more important, and therefore values need to be maintained in all aspects of human science and human philosophy. So all these are wonderful solutions. Obviously, somebody will misuse, and suppose say privacy. So privacy, you can mimic something, you can do any nonsense, because at the end, digital manipulation becomes so easy that just changing one G to F, it can bring you disaster.
Yes. Dr. Kumari Sandhya is asking, what help of AI can be in anatomy education?
All simulation technology is AI. because all the simulations depends on analysis and understanding layer by layer. So you know how they are developing. They are developing a simulation, say machine, depending upon MRI and CT scan of body. And then it goes into all those layers, and then the 3D reconstruction, which is done is through the AI. So all simulation, what is being taught in anatomy, I hope everybody has a simulation lab and all those, is all AI. So because that was not outside my topic, but then AI in medical education is doing tremendous development.
Dr. Jayalakshmi is asking role of AI in infertility. Jayalakshmi Lingaraj.
I think AI, first thing, it can give you a clue about which OI or OHM is to be identified. At present, AI is being used to find out the eggs which are disease-free. And therefore, at then it's an image analysis. And I think annotation done, image segmentation is done. It can help you to identify a better egg for fertilization. In addition, obviously, hysteroscopy would be another area where if nothing else developed, you can develop a ML DL based technology for hysteroscopy. And then injecting, because all these are the micro injections, all those injections could be handled with a DL system. I think it's a tremendous scope available.
Yes. I see a lot of apprehension among my medical peers regarding AI, many due to fear of replacement and media hype. How can we dispel their apprehensions and take them on board to adopt AI solutions?
No, we need to understand AI is not going to replace anybody. So last time I showed a slide. If you are a radiologist who doesn't understand AI will be replaced by a radiologist who understands AI. So collaborative intelligence is something, is a clue that we need to take help to make diagnosis faster, to make treatment faster, to make precise things, to have lesser faults, and everywhere at the end, physician is required. It is go through physician.
Yes, sir. I think basically once people understand the utility of AI in making them more efficient, the adoption will be automatic.
No, everything new comes, we have a lot of apprehension. But subsequently, it becomes life. It becomes day-to-day life. There is one question about virtual dissection. Obviously, we have, now these are all becomes training of skills. Now, why dissection? We are training people in laparoscopy. We are training people in all aspects of skill training by AI. So suppose you go and operate for a gallbladder, whatever you do, is all those images inside that, say, simulation machine is developed through AI. Therefore, whatever you do go on either side, it gives you feedback, and all those feedbacks are not only visual, they're haptic feedback. And that's a tremendous development taking place. And this whole thing is so nice that we are trying to find out how it can be done. Now, AI or machine learning can be used to identify your movements. And there is an entirely new branch called sabermetrics. Now, this has come from sports, that it's in baseball. They identify by doing a video analysis of a shot. So same thing can be done for surgeons. And instead of having 4 or 5 parameters, the modeling can identify 25 parameters. And then it can exactly tell you where you are doing mistakes. And I think it's a new enchanting field called surgical sabermetrics. You can just Google.
Yes. In fact, now there is a full university which has started focusing only on AI in Mumbai. Then AI has been introduced as a subject in 9th standard by CBSE. Full textbooks are available for 9th standard students. I see in coming future it might go up. 5th standard students may also be learning something about it. Like they are using, I remember there was a time when those who did PhDs gradually moved towards school and early. So this will also be moving in younger and younger students. As I predict
actually, if you see, we have courses like MTech programs are available in branches which never existed 10 years before.
Yes.
You could never foresee that there could be what you call as the MTech program in data science. Yesterday, I saw an advertisement of Symbiosis where they had MTech program in data science, MTech program in AI, ML separately.
Yes.
And I think we need to understand how the world is going. So my suggestion is population being our strength. We have so much of data and we are one of the finest intelligent, say, technologies available. So we need to marry between all that data, all those technology people become an intermediary to understand their requirement, our requirement, their feasibility, their limitation, and develop a system. And let us say you are want to do something for mammography. We have more than 10,000, 15,000 images available. And those, they take so long time. In addition, the variation is less. So we need to sell this, that we become an AI country.